Good day, everyone, and welcome to the second Global Clinical Engineering Day. Today's agenda will include a message from the President, which is myself, and message from the Advocacy Committee of ACCE, and information about Veterans Health Administration, and also videos from our institutional members, Brigham and Women's Hospital in Boston and Intermountain Healthcare in Utah. So my name is Arif Subhan. I'm the president of American College of Clinical Engineering, and I want to take this opportunity to talk about ACCE and the role played by ACCE in promoting clinical engineering and the profession of clinical engineering. So I'll start off by first talking about the mission of ACCE, which is as follows in front of you. First of all, it is to establish a standard of competence and promoting excellence in clinical engineering practice. Second is to promote safe and effective application of science and technology in patient care. Third is to define the body of knowledge on which the profession is based and to represent the professional interests of clinical engineers. We don't have a long history about our organization, but we started in 1990 through various meetings, symposiums, and those are outlined in the slide here. And our first formal organization was in June 19, 1990. Moving on to the next slide, our first board of directors, which was for the first year from 1990 to 1991, are listed here with the office bearers. And the next slide kind of talks about our members, which are the foundation of our organization. We, ACCE, is a young, dynamic, and a fast-growing organization. Our membership has increased 15-fold in 27 years. We are an 800-plus strong member organization, of which 50 are fellow members, and 15% of our membership represents 42 countries in the world. We have different membership categories, which includes individual, fellow, associate, candidate, emeritus, and retired, and it suits different career paths or levels of clinical engineering professionals. Also, we have corporate and institutional members. More details are available on the link below. As part of an ACCE member, one of the big benefits or primary benefits is that you get access to a network of experts and peers, and we are here to represent you and your interests before the legislators, regulatory bodies. We provide multiple opportunities throughout the year with trainings, educational offerings, review courses, teleconference series, and our symposiums. All details are available on our member benefit website, and I encourage all of you to look into and join ACCE. This year we have established some goals, which include obviously promoting and increasing our membership, promoting our clinical engineering profession, also talking about enhancing educational opportunities for clinical engineering, and developing closer ties with some of the academic programs that offer clinical engineering. Also move forward with our strategic planning and also developing closer relations with affiliated groups like AMI, HIMSS, and ASHE. As our membership comprises 15% of international members, we want to increase that outreach and with the help of our international committee, move forward with it. Also, within the community, develop an outreach program and promote our profession. And last but not least is to start some symposiums which we had in the past about clinical engineering, IT integration at the HIMSS conference. We have a code of ethics for clinical engineers as part of our Clinical Engineering Society, and we hold in paramount the safety, health, and welfare of the public, and they are listed on this slide. And then I move here, move it over to the Advocacy Committee Chair, Clarice Holden.
Hello. As already stated, this is Clarice Holden with some updates and thoughts from the Advocacy Committee for this year and the upcoming year. So it's more important than ever to inspire and motivate future students and engineers towards the clinical engineering field. So a way to share about clinical engineers and the profession is to just talk about clinical engineering. You can write an article or post a blog, and there's many ways and many avenues through which to do that, including the Journal of Clinical Engineering, Technation, AME, ACCE, as well as 24/7 magazine. You can also share this Global CE Day presentation with your colleagues, your friends, and your coworkers, just to give them a taste of what clinical engineering is. Another way, if you've got time and means, you can present at a career day or a school job fair at local high schools, and you can talk to your kids' schools, your nieces and nephews' schools, but it's really important to seek the opportunity to plant seeds and inspire the next generation of clinical engineers. Another way to inspire and to motivate is to invite students to shadow your clinical engineers or yourself at work so that they can see and be immersed in the environment. If you have support from your hospital, you can actually start internships with local colleges for either credit, college credit, or geared toward career training. And that's really only if you've got time, but it is a great way, and many hospitals have done that, to get additional interest garnered in clinical engineering. And all of these ways are just some ideas to advocate for the future of the profession. So up on the screen, you can see our 2017 ACCE award winners. These are a prestigious bunch of clinical engineers, and we're going to be, the Advocacy Committee is going to be submitting a call for nominations for the 2018 ACCE Awards. So we're asking everyone to be thinking about the superb clinical engineers that you work with every day, the ones that are worthy of nomination. And our call for nominations is going to be coming out in early November, and these awards are a great way to recognize the wonderful clinical engineers that work day in, day out in the field, helping to make hospitals safer places and safer areas of delivery for patient care. As part of our ACCE's celebration of Global Clinical Engineering Day, we actually invited some of our institutional members to contribute to this presentation. 3 that responded were the Veterans Health Administration, Brigham and Women's Hospital System, and Intermountain Healthcare. So we've got a brief moment for a message from each of those. So first up is the Veterans Health Administration. So the Veterans Health Administration is the largest integrated healthcare system in the United States. They serve actually over 8 million veteran patients at more than 1,400 sites of care across the country, including 152 complete hospital systems. So the VA is a huge contributor of research and is also a major healthcare educator. Did you know that 75% of all doctors receive some, doctors trained in the United States that is, receive some of their training at a VA hospital? So the VHA healthcare delivery model is segmented into Veterans Integrated Service Networks, or VISNs. There used to be 22 of those VISNs, but they're in the process of actually reorganizing down to 18 in order to better serve veterans throughout the country. In terms of a technology snapshot, the VHA has over 200 biomedical engineers and almost 1,000 biomedical equipment support specialists at each or at all of their hospitals nationally. And they service over $7 billion of medical equipment inventory, which includes several 100,000 discrete devices, including over 250 CT scanners, 30,000 infusion pumps, 5,000 monitors, beds, as well as some highly complex laboratory equipment. all in better care and service of the United States veterans. All right, our next message comes to us from Brigham and Women's Hospital in Massachusetts.
My name is Michael Fry, the Executive Director of Biomedical Engineering and Device Integration at the Brigham and Women's Hospital. At the Brigham and Women's Hospital, our clinical engineers play an important role in collaborating with our nurses, physicians, and senior hospital leadership in ensuring safe and efficient patient care technology introduction in our hospital. With the increasing complexity of these technologies over time, our clinical engineers apply consistent engineering principles to ensure a reliable and consistent operation of these technologies over the life cycle of the devices. One may ask, how do you get to that point? We also have internship opportunities at our hospital where we collaborate with universities around the Massachusetts to expose our up-and-coming clinical engineers to the clinical environment and applying these engineering principle skills so that they can learn that to be ready when they get out of school.
Hi, my name is Hannah Frank, and I'm one of the clinical engineers here at Brigham and Women's Hospital. One of the large projects that I've worked on over the last 4 years has been our EPIC, our EMR, biomedical device integration. This has been a large project that has provided many benefits to the hospital, some of which include reducing transcription errors, as well as freeing up some of the clinical time for nurses and staff to spend time with patient care directly. As part of our implementation, we've had to do many different tasks, including running cables up to the patient floors to the bedside, running additional fiber between floors to the network closets, as well as training our staff on how to support this new technology. Behind me, you'll see one of our EPIC test labs. This test lab features all of our technology, ranging from our solar and dash monitors to some of our newer B-series monitors, as well as our central station. What this test lab allows us to do is to train all of our existing as well as new staff on how to troubleshoot any integration problems, how the mapping works, as well as troubleshoot basic technology problems with the monitors themselves. This is an example of some of our network infrastructure. You'll see these orange fiber cables on the top portion go to all the different clinical floors, as well as some of our operating rooms. All of the green cables are Cat5 cables connecting over to all of our servers. We have additional racks that house all of our server technology for both our telemetry as well as all of our integration services.
Hi, I am Carrie Ann Jack, Business Manager of Biomedical Engineering here at the Brigham and Women's Hospital. Brigham Biomed is made up of 40 employees that include administrative staff that triage customer requests and order our inventory. This also includes biomedical equipment technicians that repair our devices and maintain compliance, and who work alongside our clinical engineers that collaborate with both the technical and clinical group to manage projects. We are fortunate to have several certified BMETs and CEs on staff. At the Brigham, we manage over 26,000 patient care devices, both at the main campus and at 15 off-site locations, while completing over 35 different projects each year. With funding from our annual operating budget, as well as our yearly capital budget allocation, we work together with key stakeholders, both in the budget office and our clinical champions, to ensure that we're routinely replacing devices. Our guiding principles ensure that we replace obsolete equipment, maintain a clinical standard, as well as to ensure we introduce technologies that improve efficiency. Our Brigham team is committed to safe and efficient patient care while using technology to solve clinical challenges.
My name is Kevin Kreitzman. I am the Assistant Director of Biomedical Engineering at Brigham and Women's Hospital. One of our greatest challenges is how do we use data to drive our initiatives and improve our operations. Our department was part of a multidisciplinary team that was tasked with analyzing the physiological monitoring alarms that we have across our institution with the intent of reducing alarm fatigue and making our alarms more meaningful for our clinicians. What started as a 12-week, 4-phase pilot effort turned into a 6-month, 6-phase effort that resulted in a 78% reduction in all of our audible alarms from our monitoring system. As a technical resource on that team, our department was really tasked with understanding what the alarms were, how they were generated, but most importantly, how can we get at that data, how can we extract it, and how can we present it so it's meaningful for our clinicians and that they can make decisions based on that. Our department developed a tool for pulling these alarms from the logs of our monitoring system, quantifying them, presenting them in a way that was meaningful for our clinicians, and then helping provide feedback into what initiatives we could do to reduce them. As a result, our institution is now much quieter and our alarms are much more meaningful for our physicians. Other opportunities like this also exist at Brigham and Women's Hospital. Since I started at Brigham, we've always had a real-time location tracking system, which we've used for tracking clinical assets across the campus. We recently opened a new multi-specialty clinic, the Building for Transformative Medicine, and one of the initiatives of that clinic was to use this system, expand its use, so that we could track patient workflow and look at process improvements in our clinic workspace. Since its go live, we've been working with our operational leadership in those clinics to assess things like patient throughput, patient-staff interaction, room utilization, and other metrics that will help us improve operations. Also with our RFID system, we recently deployed a pilot effort in our emergency department to help track our trauma attending arrival time to traumas in the ED. This is important not just for process improvement, but also from a regulatory perspective so that we could keep our level 1 trauma status as an institution. Our implementation of this system allowed us to readily identify when a trauma attending arrived at a code trauma in our emergency department and provided a tool for our quality improvement individuals within the ED to pull that data to provide reports for regulatory compliance. Another area where our department's been asked to use more data analytics is in the capital planning for future medical equipment purchase across the institution. What used to always be an assessment based on age of our inventory, repair history, is now also including how much do we actually need, what is our utilization of equipment, and where do we utilize it. Some examples of where we've applied this is with our infusion pumps. Infusion pumps are a huge challenge for all of biomedical engineering departments as well as the institutions in managing. We were able to take data from our wireless infusion pumps as well as data from our real-time tracking system to not only identify where our equipment is, but identify what of that equipment is in use. As a result, we were able to use that data and really provide a quantitative measure of what our inventory is, what our utilization is. Instead of buying additional inventory, really look at how we manage what we have. Other opportunities for applying this were with our monitoring system, where we have a pool of mobile monitors that we utilize across the institution. And the sense was always that we didn't quite have enough. We were able to, again, use our real-time tracking system. We're able to pull data from our monitoring system to say, here's where these monitors are, here's the ones that aren't in use versus the ones that are in use, and really look at how we manage the distribution of that equipment versus just going out and buying more equipment that would essentially be faced with the same challenges. Here at the Brigham in our biomedical engineering department, we've seen a lot of opportunities to take data analytics, apply them to some of the initiatives and some of the decisions that we try to make, not just within our department, but for the hospital as a whole. I think the value has really shown itself and resulted in not only improved patient safety with respect to our alarm management efforts, but also more fiscal responsibility in our institution for how we go about the selection and the purchase of our medical equipment.
All right, next up is Intermountain Healthcare speaking to us from Utah in the United States.
Hi, this is Mike Busticker, System Director of Clinical Engineering at Intermountain Healthcare based in Salt Lake City, Utah. Just wanted to provide a little bit of information on a celebration of the Clinical Engineering Global Celebration for Clinical Engineering and talk about just a couple of things that we're doing here at Intermountain Healthcare. Initiatives that are going forward in moving the clinical engineering field along and progressing, and just share a little information with those around the world that are involved with the clinical engineering or HTM field. Here at Intermountain Healthcare, we're about 23 hospitals, 185 clinics. We have a staff of 115 throughout the clinical engineering department, and we cover the entire state of Utah with a hospital as well in Idaho. All along the I-15 corridor here, so fairly significant organization here in Utah, and providing great service to our patients and our caregivers and stakeholders within the system as well. One of the initiatives we're working on is probably something that everybody's heard of throughout the entire world and the clinical engineering organization, or HTM field, and that's cybersecurity. Here at Intermountain Healthcare, we've put a lot of effort and time into the cybersecurity initiative, and a lot of that involves collaboration with our IT department. So really cross-functional here at Intermountain Healthcare with our HTM, or our clinical engineering technicians, our leadership staff, as well as the IT leadership staff and their cybersecurity department, in looking at the risk that's associated with our medical equipment. Some of the things that we're doing, not just the internal collaboration between our IT department as well as our HTM or clinical engineering field, is involving organizational leadership in that initiative so they know what the risk is to the organization. We're also partnering with external companies like MDIS, NHISAC, as we continue to move forward to try and help the industry as a whole instead of just Intermountain Healthcare. So any information that we can provide within our system that will help the field is something we feel very strongly about here at Intermountain Healthcare. So we're working with those organizations to look at a standardized type of a database for risk analysis of equipment that can be shared not only throughout our organization, but throughout the entire industry and potentially across the world as well. One of the other things that we're working on here at Intermountain Healthcare, we've established an internal clinical engineering audit process for our organization. So we, on a every other year basis, we go out and do an internal audit of our entire clinical engineering programs at all of our facilities. We do this to look at standardization of processes and workflows, to make sure that on the regulatory compliance side that we're providing the same data and information to our surveyors or regulatory agencies. When they come out, they see the same thing from facility to facility to facility, so we standardize those. We standardize our policies and procedures across clinical engineering, as well as looking at best practice sharing. We may have one of our facilities that's doing something that's a best practice in tracking or implementing their clinical engineering program, and we want to make sure that we share that across the entire organization so that we've got those efficiencies, not just cost savings, but efficiencies and workflow processes for our organization as well. One of the other things that we're really looking at is our equipment downtimes. And I think we're looking at it from a different perspective. Instead of saying our uptime of our equipment is 99% or 98% or 95%, we're looking at how can we impact patient care and treatment by the reduction of those downtimes. So we ask questions like, was there a patient on the table? Are we having to reschedule patients for exams? What is the impact that we're having on patient access to care and treatment? And then if we have extended downtimes, we're doing root cause analysis on that extended downtime to see how can we reduce that so our patients have access to that equipment and treatment that they need at the time that they need it. So we're really digging into the downtime piece and how we can actually impact that to include not just our internal program and partners, but also looking at our authorized service providers and how they can collaborate with us in order to provide the best care and treatment for our patients as possible. And the last thing I think I'd like to talk about is our succession planning. As we look at the future of the HTM or clinical engineering field, we're going to have a shortage in not too long because of the aging of our HTM professionals, and as they retire, and the limited amount of schools to train people to come into this field. So within the organization here, we're looking at how do we have that succession planning. So we put together a skill knowledge competency assessment piece for our technicians so that they know what we expect for them to be at a level 1, a level 2, or a level 3, and what the expectations are for them to move into a supervisory role or a managerial role, so that they can look at those items. We can put together development plans for them to move them through the organization in their career, as well as establishing knowledge expectations for those that would like to get into the field on what we would like to see them have as they come in as a level 1 or an entry-level technician. those are some of the things that we're doing at Intermountain Healthcare. We really like to share all that we're doing with the HTM or clinical engineering field across the world in anything that we can do to help improve the field, improve patient care, and improve patient outcomes.
So ACCE would like to thank our 3 institutional members who contributed to this CEDay celebration, as well as our many members who actually sent in their photos of clinical engineers out and about their work. So please enjoy their slideshow. So thank you for joining ACCE in celebrating Global Clinical Engineering Day. Thank you all for the fantastic work you do every single day. Have a happy Global Clinical Engineering Day. Thanks.